I have to disclose for me the two giants that preceded me in this, Brent Rooney, a medical researcher out of Canada, and Dr. Byron Calhoun, the West Virginia OB-GYN department chair there, who came here and brought this information to us some years ago and enlightened us. I have been told that there are no grounds for our link too. But as he points out, and I'll try and show you some of these, there's two very simple reasons for why the cervix can render itself incompetent. What happens during an abortion? Instrumentation. Okay, they have to put a probe there, all right, for an abortion. For the vacuum abortion, it's a small probe with a light. There's that probe moving up and down is instrumentation. The instrument that has a sharpness to it and quality, the actual abortion instrument, has sharp edges. That's for the removal of, as they call the contents, we call the baby. Okay. Anatomically, from physiology, yes, fetus. But the woman who's early on says she's pregnant, she says she's pregnant with a baby. So I like the baby term, and we like to use the baby term. They claim that those instruments have changed, I guess, because they say, well, it's different today. It's not any different. You're still using instrumentation. That's a risk for infection. All right. And pathogens. And those pathogens are the problem. And those are the two main reasons for why we set up a risk factor. Let me just see if I can turn mine on. Is it coming up?
Hit the slideshow.
Hold on just a minute.
Oh, yeah.
Thank you. Mitch is
The far left.
far left, Mitch.
No, down.
No, it's not. I knew a young, this is what I said. Thank you. This is Catherine's daughter. See how necessary it was? She could talk to her. Now, if I do this, will that come down? This is the background for the executive order from Minner I talked about. The incidence of preterm delivery is 6% in the U.S. The very preterm birth I mentioned. And he pointed out in this one, the induced abortion is associated with a very high health cost annually. We all pay for that. It's a plague not only of this state, but the world. And let's just get to where he... All right. Here it is. Cervical trauma with the incompetent cervix. The damage is the dilatation, the curettage, that's the instrument that has to do the scraping, and some ascending infection. All this leading to the rupture of the membranes. All right. Unfortunately, when you look at, I happen to find it in my husband's office, Planned Parenthood Federation, an article in a woman's health type magazine. The myth was very prominent there. They publicly, nationally, there's no risk for an abortion. No infertility risk, no risk. They deny the breast cancer risk. They deny the premature birth risk. That's what we're up against. That's why when we come to defend this, we have to know our facts. Again, why we're here today. I want to point out that one of the designs of the DMIC study in 2010 that was presented to a national audience discovered that the lowering of the premature birth rate for example, from the good programs, like something called Healthy Beginnings. Is anybody a part of that here? I'm sure Levaita's been part of that. That they can reduce, these good programs that we're about, can reduce the premature birth from the first, perhaps, pregnancy to improving that outcome for the second pregnancy. And that has been their goal. And they've been very good at it. But they're missing some of this questioning that I'm going to address to you. There are no specific questions on a tool called the PRAMS. If anybody in public health has had to use that, I found one question, it was 22F. It asked if there was a history of incompetent cervix. And there was very low reporting of that. And I feel like the question should be these. Have you had an induced abortion? Have you had a medically induced abortion? And I'll tell you why that's important. The RU486 or the other one, the misoprostol. Did you suffer any side effects from either surgical or medical abortion? These are the questions not being asked from the PRAMS questionnaire or from the FEMUR quarterly meetings. Were you informed that abortion would increase your risk for premature birth? Did you go for follow-up care after your surgical or chemical abortion? Do you think these are good questions to ask?
Yes.
Okay. At any time, did you receive methotrexate? This is a new one I've learned about, for a tubal pregnancy. These are important questions. They need to be asked. We don't need to say, well, we don't ask those questions because they're politically incorrect. That doesn't have anything to do to help the woman who's trying to make that important decision in a crisis pregnancy. My goal is to see these questions asked, and I need your help for it. We need a informed consent bill. I think we're going this week for a parental consent bill. But on Tuesday, right?
Yes.
See Dr. Mary about that. But we need to come up with a bill that gives these, that will use these questions and will have for the state of Delaware a thorough informed consent bill. And you know what? If we got that bill, I'm sure we're going to get a response from DMIC and from FEMUR to start, when they're doing public health and actually Planned Parenthood received funding for this. They didn't do all of this pregnancy-related good things. They boast about it now. They got money from the consortium, millions, to help, as did other clinics, St. Francis included, some of the other small clinic operations. They got money to help the consortium to provide good services. But unfortunately, my personal take of it, it's also weighted in the going out to do the contraceptive work. And I'll show you why before I close everything. We will fail the women and the babies if we don't discuss the A word. I've heard it called the A word. They have, in their very official and very well thought out meetings, they're using designs from the national level at our state level. And they have come up with preconceptual health, intraconceptual health, and these are family-friendly terms. They are medical terms, but again, weighted for the contraceptive-based mentality. They're not following up with contraception has those consequences. And I want to give you a copy, or I want to read just quickly here what some of those questions were that I found. And you can go to a website for FEMUR. I just Googled FEMUR, F-E-M-I-R, and I got, for State of Delaware, and I got, there you can see their annual reports. They call themselves more clearly the Child Death, Near Death, and Stillbirth Commission. And they reviewed 136 of the cases this past year. And under family planning, because that was my area of wanting to be the watch guard for. It was the birth control in the immediate postpartum period in compliance with chosen contraceptive methods, quote, i.e. no missed doses. Family planning, counseling with contraception dose/script or bilateral tubal ligation prior to discharge. Now, this is being imposed on women when they've just had their baby and they've just gone through labor and they've got to be confronted with the contraceptive-based mentality. That's very hard-hitting to me, and it's taking advantage when you're most vulnerable. Can you imagine if you did sign up at that point for a tubal ligation? Guess what? There's even hope on that. In the last few years, I've met women who went back, and they've actually formed groups. They have an official name that escapes me, but they are people who had their tubes surgically, I guess, fixed. And they now feel that has anybody known the name of them? Reanastomos. Well, but they have another name they call themselves, and they're very proud of it because they felt like they had been actually violated with that kind of mentality in their OB-GYN experience. Persistent follow-up, conception, family planning, when patients initially refuse services in the hospital or the postpartum visit. How invasive to me is this? Community service agency to see patients in hospital post-delivery, to give contraceptives before discharge, and so on. Is there an agenda there or not? Okay. Can we offer something better? I believe we can. Okay. I wanted to point out that when I said 50 years ago that we knew about abortion and the premature birth link and through the incompetent cervix, it was written about by a Barbara Luke, Dr. Barbara Luke. And this is out of print, but we had a speaker at the consortium who said she's the only one who wrote the book about it. And she comes from the contraceptive-based agenda. Hers is Preconceptual Healthcare Practical Guide. I looked at and researched most of her work. She's has written extensively. It's all in the mentality of the family planning. It's the population control agenda. Okay. And again, the quick fix, that's not the quick fix. There are problems associated with that. And it has a big part to do with that mystery. I want to mention before I sign off here, the methotrexate, the RU-486 and the chemical abortions. The two things that have been thrown up to me is that, again, that somehow abortion is better today than it was then. According to what our events in Delaware, it's even worse than it was then. And the other part, we've got medical abortions, so we don't have those same risks. Well, a very interesting study that I found was that it actually, there's a Clostridium bacteria. There's a septic shock association with these pills, these medical abortion pills.